Hi everyone, my name is Abna Sapomani Maku-Entry, a NICU specialist at the Trust Hospital. So today we are creating awareness on prematurity. And prematurity, this year's theme, we are touching on equitability or equitable care for every preterm baby. But let's walk you through what NICU is or what preterm delivery is. Preterm delivery is a baby born too soon. Too soon, that's below 37 weeks of gestation. That you cannot able to carry your baby to 9 months. That's in layman's term. When you've not delivered your baby at 9 months and you are below 9 months, it's term preterm baby. And preterm baby have a special nursery, a special room we keep them, and that's called the NICU. So what are some of the things that happens in the NICU? But before I go into that, let's talk about some of the things that may cause a baby to come out too soon. So we have some maternal factors coming from the mother. We have some fetal factors as well. That's the baby in utero. So some maternal factors we may talk about is infection. If a mother has infection during pregnancy and is not well treated, it's prone a mother to have a preterm baby before her time. And also some chronic conditions like hypertension, diabetes, if not managed well, if one is not taking the treatment religiously as it's supposed to be, it's also prone you at risk of also having a preterm baby. Can this preterm delivery be prevented? Yes, it can, but not all the time. Sometimes it's beyond control. You can take all the precautions, you can be very much careful, but then we see it happening. And when it happens, don't blame yourself. Don't blame anyone. It's no one's fault. You did your best. The health workers did their best. So when it happens, what then do we do? That is where the NICU is for the baby. So this baby is brought into the NICU to continue life or to continue to survive. So I didn't touch on the preventive measures. The preventive measures we can do is attending regular antenatals. All our visits, we have to go. And also we have to start early, very importantly. And the moment we are diagnosed of any chronic condition, we have to bear in mind, we have to stick to our treatment religiously. And also, if we see any sign of labor, we shouldn't hesitate to stay home or even talk to family or friends or go to the pharmacy for medication to stop contractions or pain. No. Let's visit the hospital. Talk to your doctor. Talk to your midwife. Visit the hospital. Let's save your life. Let's save baby's life. So coming to the hospital, you are trying to prevent it. But sometimes you may end up coming in and measures that are being put in place may not sustain the pregnancy, but then to deliver you before your time. That is not a problem. The NICU is there for survival. This baby will be brought to the NICU. And what happens in the NICU? We give the baby that intrauterine life he or she was receiving in utero. That we term it developmental care, and a lot goes into that. We assume the baby in the position like he or she is in the utero. We feed this baby as baby was being fed in utero through our IV fluids, sometimes through our very, very little milk supply that comes from the mothers. And also, we also give them the boundaries they get in utero. We also give them that calm, warm environment they were receiving before. And most importantly, as they are even out, it even helps us to even monitor their life progress. So our doctors, pediatricians, nurses are all there to go to do this monitoring for us. We assess them every day. We do daily assessment. We do daily diagnosis. We do daily treatment. So per what every baby needs, as we are emphasizing on equal care for every baby. So depending on the need that you are asking for, the baby is asking for, we give exactly what the baby needs as he or she is asking for. So aside that, babies coming into the NICU, one most important thing we do aside the baby is dealing with the families. Families get emotionally down during this stage. In fact, the anxiety, the worry, the blame and all that is a whole lot. So we don't just take care of the baby, but then we also take care of the mothers. Few times we invite psychologists at our premises to come in for us to talk to these mothers, to reassure them, give them the assurance that baby is in safe hands. Yes, baby is always in safe hands. And also, our nurses, our medical team give a daily update on baby status, baby's condition, all to just relieve anxiety, all to just to emotionally stabilize these parents we have in our care. And most importantly, what we normally see, the results from this we do is that they even end up giving us some support to even care for how we go about caring for their own baby. They get that confidence, they get that love. They even try to even encourage other new mothers who comes to the NICU. So that's where we say we have succeeded, and that is where we can say that this mother and baby is ready to go home. And also to the public, the NICUs are doing their best, but then equal care can be done both by health workers and also the public. We need you in our NICUs. The NICUs need you. Once a baby comes out of the NICU to their homes, we encourage each and every one to celebrate this baby, to welcome this baby to their home or to their public space. Not forgetting giving donations to our NICU areas. We need it. Talking about if you are in Accra, Trust Hospital, we need it. Incubator, whatever in your capability that you can give to support the NICU. As we are all saying, this year we are going to give equal care, equal love, equal resources to every baby. Then the public too has a role to play. If you are in Accra, Trust Hospital is ready. We are located at Osu. If you are outside Accra, get a NICU nearby, get a regional NICU, get a district NICU, and show some love through donation, through kindness, through any means that you can. And remember, this year we are giving equal care to every baby born too soon. We are here to love, we are here to care, not only for our babies, for the family and for the whole nation. Thank you.